So guys, I've just been filming for like the past 5 minutes and I haven't pressed record. So I've just been yapping to myself. Anyway, on a lighter note, hi guys, welcome back to my channel and happy new year, because this is going to be the first official video for this year 2025. If this is your first time coming across my video or seeing my face for the first time, where have you been? Okay, welcome to the channel. My name is Matilda Christian. I am an international student and a third year nursing student as well, and on my channel I basically just post content around nursing, share my experiences as an international student, taking you guys through my journey to becoming a registered nurse. Now if that's something you really want to see how it plays out, we're very close, okay, to becoming a registered nurse. Please do stick around by subscribing to my channel. Anyway, not to digress, let's get straight into today's video. Today's video, I'm going to be sharing with you guys a couple of things I think are essential for nursing students when they're on placement or when they're about to go on placement. I'm a third year nursing student, if I haven't mentioned already, and I have gone through a couple of placements. I have done 5 placements ranging from 7 weeks to 12 weeks. Okay guys, that is a lot of time, a lot of experience I've had, so I know the things that that helped me, and I feel like it's going to be good or useful for you guys. So yeah, and also because the students who are going to be coming in this January are going to start their placement in a couple of months time, so I felt like this is a nice video to do right now, and of course you guys can always piggyback on it. Without further ado, let's get into the video. In no particular order guys, but I really wanted this to be the first thing I showed to you guys because it's really important. This is what you need. This is an essential, guys, trust me. Look guys, if you're anything like me, I never had any experience prior my placement, so I hadn't even been in a hospital, hadn't had any interaction with patients. I don't even know what the walls of the hospital look like. Okay, so going to the hospital on placement was literally my first time, and yeah, it was a lot for me. It was a lot to take in. So guys, you need a massage gun, because when you come back from placement standing like 12 unpaid hours, I had to put that unpaid there, okay, 12 unpaid hours, then you're gonna know that you need a massage gun, unless you have money for massage every weekend, then of course do you. But if you're like me, that we're still chasing the moolah, then you need to get this massage gun. I think it's a good investment. If you get this, you've gotten it. Okay, so this one has been through a lot. Okay, but this is what it looks like guys. Comes like with different kind of shape, so you turn it on. Can you guys see that vibration? Yeah, you go like on your back, like those places where it aches, your waist. Can you guys hear that? But yeah, it comes different, like for it to target different areas of the body. This one you can use it on your neck, shoulder, like different areas where it hurts guys, because trust me, you are going to be in a lot of pain by the time you're back from your placement. So the next thing on my list is, can you guys tell what this is? This is a compression socks. Okay, this is a new pair. I just opened it. I have my usual ones, the one I've been wearing. As we nurses, we are at risk of deep vein thrombosis because we stand for long hours, and when you stand for long hours, muscles in your calf don't really contract. So when the muscles don't contract, you don't get enough blood circulation, like from your heart to your body. You don't get enough circulation, and that causes deep vein thrombosis. And some of the things you would experience is swelling in the leg, veins. You can see like getting visible veins and stuff like that in your leg, which is not good. Which is not good, guys. If we're here to help patients, we might as well help ourselves. And so that is why you need compression socks. So this helps blood circulation. You can find this on Amazon, guys. It is cheap. I can't remember how much I got it, but I know it wasn't out of the pocket. I know it wasn't like too expensive. So yes, you can get different colors, guys. You can get a lot of designs. I just wanted black, so yeah, get yourself a compression sock, guys. It is going to save your life, quite literally. The third thing I have on my list is comfortable shoes. Quite cliche, but a couple of things I'm gonna say is quite cliche, like, oh, you should know that, but guys, I promise you, you really don't. So get yourself some comfortable shoes, black obviously, okay, because usually you're meant to get certain type of shoe, those like ancient of days shoes, like those grandma's kind of shoes. But now you're allowed to get fancy sport, this is not fancy, this is a Primark, but you're allowed to get cute shoes, and some words that I've worked in accept like colored shoes, but it just has to be plain. Guys, when you're getting your shoes, you want to make sure you're getting memory foam, okay, that it's going to save your life. It helps. So like I said, I got these ones from Primark, and guys, I have been using this for 2 years and they have never failed me. So if you want to break the bank, if you want to go for like expensive shoes, go ahead. They have like Skechers and like other brands, you know, that you could literally go. But personally, I didn't break the bank. I got this like for £8 at Primark, and this is one of my best comfortable shoes so far. I wear this every day during placement, even like my actual job, and you know, very easy to use. It's also washable, so you want to get something that you can put in the washing machine, or something you could just wipe off, you know, wash with your hands or something. So get a comfortable shoe, guys. You're gonna be standing long hours in these shoes. Then we're going for something fancy and like anyway, now the third, is that the third or the fourth? I'm just gonna quit saying numbers and I'm going to say next. So the next thing on my list is a pocket book. Guys, this book has my brain. Oh, look at that. This book literally has my brain in it. Okay, every information I get on placements, I'm literally putting it down here. I have informations about IVs, you know, medications, what they're used for, or some kind of sickness, you know, the triggers or symptoms. You know, there are a lot of things here, a lot of things, guys, that I can't even really start telling you guys about. So this is like very essential, guys, as nursing students. In fact, you shouldn't be going without a book, because you're going to look like you're not serious. So go get yourself a nice pocket-friendly book. By that I mean something that could just fit into your uniform. And now you can take handovers with this. I write a lot of things here, especially when maybe I'm talking with a doctor and they sort of mention something that I haven't heard in my life, or I don't know what that means. I repeat it in my head and I immediately go down to my book and write it, and that's going to be like a study for me, you know. So yeah, it's very essential. Get yourself a book. You use it for almost everything. Okay, the next thing on my list is a good backpack. Guys, it's not really big because it's close to the camera. Okay, that's why if I take it back, you know, it's really not big. So guys, what you need is a good quality. You seen that quality? Like, this goes into the washing machine. You can also wash this by hand. This is good quality bag, and guess where I got it from and how much? Guys, tell me, let me know how much you think I got this bag for. Yeah, you need a backpack that is going to be durable, has lots of pockets. There's another one there. Now guys, I really want to hold your hands when I say this, guys. In case you're in this category, if you have a tote bag, please throw it away. Throw that bag away now, guys. As I'm talking to you, go and throw it away. What are you doing with a tote bag? Make it make sense, guys. You don't need a tote bag. I know how aesthetically pleasing it is to have like a tote bag hang in one of your shoulders, but guys, you're doing yourself more harm than good. I promise you, you need a two-handed backpack, you know, that balances off the weight and not like put all the pressure and everything on one arm. So guys, the next thing on my list is, guys, this is my last card. I have to like get more, but guys, you need a painkiller in your bag always. Standing for 12 hours, guys, is no joke, and you're gonna have headaches, you're gonna have aches, you're gonna have this, you're gonna have that. Okay, you don't want to be in pain. Like, guys, honestly, being in placement when you have like lots of hours to cover, you don't want to be doing that in pains, guys. Just go prepared. Get yourself like a good painkiller, whatever works for you. Get those medications that are gonna help you when you are stressed. You are gonna need it. Guys, the next thing on this list, which I think is probably the most essential thing, is essential oil. Obviously I'm running out. I'll show you guys. Can you guys see what's left of that? I'm obviously going to refill this before my next placement. It's just a small bottle I got from a brand, and they just had this cute sample size bottle in there, so I just use it. Again, we want to be getting things that are pocket friendly. We want to be getting things we could just like into our pocket. Okay, so this holds essential oil. So what I do is I get an essential oil. I love lavender, so I use lavender and I put it in here. Okay, so that sprays easily. What I do to help myself, because sometimes the smell, the oozing is just too bad to too bad to function, literally. So what I do is, with my essential oil, I spray it on my nose mask and I go like that and I use it. If it's too strong, you can always double your nose mask, and use that, and that is gonna help you do your job better and efficiently, because guys, you are going to be doing a lot of patient assessments, dressing, there's just a lot to do in the hospital. You're probably changing colostomy bags, you're going to be changing dressings. Imagine changing ulcer dressing that is oozing. There are lots of things I could literally think at the back of my head that the smell is not going to be pleasant, and as a professional you don't want to go into your patient's room and like changing the dressing or doing anything or assessing a wound, something, I don't know, and then you're going and you're doing that. That is not professional, and that is going to make the patient feel sad, obviously, because who want to be in their shoes, so go prepared, spray your mask and get ready, and go in there. And that, even if you're not the one doing the job, sometimes you could be like a chaperone, you could be called to just watch the whole procedure, and you still need to be prepared because you want to breathe fine. Okay, so the next thing on my list is there's no need to do them one after another because they come handy. They come like this is a hand sanitizer, and this my hand cream. I can't remember where I got it from, but this is the shell powder one. And guys, look, this again is cliche but very important, because in the hospital, guys, you are going to be touching a lot of things. You're going to be dealing with like bodily fluids, patients that you don't know where they've been. Need I even say more? I don't. This speaks for itself, guys. You need to control infection, you need to minimize transfer of infection, so you need, oh, that smells good, so you need your own personal hand sanitizer. Like I said, make sure everything you're getting is pocket friendly. You can put this in your pocket. I always have it in my pocket, not always, but most of the times I have it in my pocket, and I always have this one in my pocket because I do not like hands that look ashy. Okay, it doesn't feel nice, it doesn't look nice. So make sure that your hands are like always moisturized and your hands are sanitized. Ideally, all hospitals should have, what do I call it, sanitary stations where you have hand sanitizers, you have hand cream and stuff like that. But sometimes they run out. It's a hospital, everybody uses it, so we want to have your one that not everybody can even have access to. You want to have your own thing, your personal thing. And guys, I almost forgot to say, not that it's not important, it's really, really important. But guys, the next thing is, guys, water. Okay, you guys need to stay hydrated when you're on placement. Nurses are being diagnosed with like AKI because they don't drink water. Okay, we drink more caffeine than water, and it is not good. Personally, what I do to help me, because I don't have my water bottles here obviously, but it's to get fancy bottles that sort of excite you to like want to drink out from it. That's what I do, and that's what helps me. Sometimes I also set little reminders. I've heard like students faint because of they're dehydrated. Okay, it's very easy for you to go woo, like lightheaded, very, very easy when you're not hydrated. So guys, please stay hydrated. It helps to make everything nice and jiggly. So the next on my list is you need pen. Hospitals always have pens lying down everywhere. If you go to the reception, you can always get a pen. They steal pens. Okay, yeah, the nurses are thieves when it comes to pens. Like, they all steal pen. I'm guilty of it. Even you that's watching this video, you're guilty of it. Okay, you are guilty of stealing pen, and you're still, even if you haven't started placement, you're still going to steal the pen. It's just inevitable. Maybe not intentionally, but you're going to borrow a pen from somebody and you will never see that person again, and it's going to become yours. Okay, so there's always pen, but always make sure you come with yours just in case. Come with an extra pen in case you lose one, but if you do, there's always pen lying down in the hospital. Still one, okay, but you didn't hear that from me. Okay. The next thing on my list, which I don't have like a physical copy, I never have, never will, because thank God for technology, is the BNF. Okay, the BNF is like a guide for medications, if probably like you during your placement, because the nurses like to test your intelligence, or the doctors, anybody could just want to see where you're at when it comes to your pharmacology. And you can get questions like, oh, what's this medication, what's the interaction, what is it used for, what are the common side effects. So yeah, even if you don't know it, because you're not meant to know everything, as long as you make reference to the BNF, then you know, that person could be like, okay, at least you know what you're doing. So always make reference to the BNF. Okay, I wouldn't say get the BNF, like get the proper copy. It's, I think, that big, so if that goes into your pocket, it's gonna take like lots of space. However, you can always access it on your phone. So get the BNF for drugs and stuff like that. So this is the final thing on my list that is essential, that I think you need to know, is the Medusa. It's like the BNF, but this is just for reconstitution of IV medication. So if you're ever like in doubt of how to administer like an IV medication, or the rates to give it, or like the calculations, or what you have to like dilute it with, go straight on to Medusa. Just ask your facilitators, your mentors, like somebody from your school, your teachers or whatever. They should be able to give you the password. Get the password, get on there. All you have to do is type the medication. For example, you want to give tazocine and you don't know how to dilute it, you don't know how it's given, if it's given through free flow, or you have to use like a pump, or you know, whatever. Put it onto Medusa and it's going to literally tell you what to do. Imagine a nurse just comes to you and be like, okay, let's go to the drug room, we're gonna be doing this medication, and they just give you the drug charts and say, okay, go ahead, get the medication and mix everything, and you're just gonna be like, if you don't know what to do immediately, guys, just be like, do you know what, I haven't given this medication before, so I'm gonna go on Medusa to see how it's been reconstituted. These are simple things that you do that make you look like, especially for a first year. If you're doing these things in your second, third years, like obviously, of course, you should know, like you've done this like a couple of times. But as a first year student, you're making use of your Medusa, using your BNF. You know, you're just prepared, you're just ready. It's just gonna make your nurses look you like, wow, this girl is so proactive, so beautifully, you know, prepared and all that. So before I end this video, guys, I just wanted to put out there that you don't need a stethoscope, okay? We students, nurses in the UK, we don't make use of a stethoscope, so please don't waste your money in buying that. You don't need it. Instead, use that money to get like a massage gun, like I said in the beginning of this video. You don't need a stethoscope. Doctors are the ones who use a stethoscope here, unless you are working in respiratory, otherwise you don't need it. Okay. Anyway, guys, if you've watched this video to this point, I really want to appreciate you. Thank you for sticking by, thank you for watching my videos. Please guys, don't forget, new year, new you. Okay, don't just watch my videos and not subscribe. Subscribe to my channel, give me a thumbs up, drop a comment, and let me know what video you want to see next. And I'm going to see you guys in my next video. Until then, it's bye bye for now.